Say and spell your name one more time.
Esther Herring, Esther, Esther, Herring, Herring.
That'll work. Okay, we're ready.
All right.
Okay, the first question I have for you, Esther, is why did you choose advanced pain management?
Well, Dr. Yagnet was actually chosen for me. My primary care physician recommended him for pain management, and I met him several years ago, and he actually moved from one facility to another facility, and I followed him. And I'm happy with the service. I'm glad that I met him.
That's great. Would you recommend advanced pain to friends and family?
In fact, I have. I have recommended Dr. Yagnet to friends and family, and I'm like, he provides relief, and he doesn't provide relief by doping you up, so to speak, by giving you medicine so you feel better. He actually tries to fix the problem rather than put a Band-Aid on it.
That's great. That's excellent. How has your life changed since?
My life has changed. I sleep. I'm more comfortable when I sleep. When I am at work, I have to get in certain positions that are make my hip hurt, which the area is at, and I can go there, and it doesn't hurt, and I'm not like grabbing my hip every time I turn around because it hurts so bad. But yeah, I am. He fixes it. Yeah.
And in terms of fixing it, what did he use a combination of therapies?
He did. He used a combination of therapies. He used injections as well as medication. But he didn't give me a whole lot of medication at one time. He kind of, let's try this one, see how it works for you. If it doesn't work for you, we'll back off of that one, then we'll try another one. We're not going to try a whole bunch at one time because we want to know how each one reacts with your system. So he gave several different options, and I chose the options that seemed to fit for me, and yay.
That's great. Let's see here. Can you explain the process he used with you and how it helped you achieve your goals, your daily goals?
Yeah, well, when I first met him, he took a thorough history, and he did kind of a neurologic physical exam to see where I hurt, what specifically was the area, and he was assured that it was the area, and so he knew what to treat. And then he like I said, he gave several different options for treatment, and he explained what each treatment would involve. The medication may make you feel this way, but if we do injections, it'll take a couple of days to work. So he explained everything thoroughly, and gave me the option of which way to go. And he's so nice. He's incredibly nice. And he doesn't make you feel, he speaks to you in terms that you can understand. He doesn't talk over your head. And
that's great. My next follow-up question to that would be, how is the staff at the office?
Oh my gosh.
At Advanced Pain?
the last appointment, the staff at Pain Management, so great. The next to last appointment that I went to, my hip was hurting so bad. I actually got asked, did you just get off of work? In fact, I had just gotten up and gotten dressed for work. But I was so tired and had been hurting all weekend and had just moved the wrong way and put a kink in my hip. And I was hurting so bad. And they happened to have a cancellation for an injection, and they worked me in that morning. They had to check my insurance. Everybody worked together to get me in the door that morning to give me an injection, and I knew I would get relief. And I sat there. I seriously just about cried. I was so happy that they were taking care of me, and that's what I felt like, that they were taking care of me. And yeah, it's comfortable there. It's so comfortable there, and the staff is just great.
That's excellent. I really think those were all the questions I had. What do you think, Coley?
Okay, and we're rolling.
All right, Esther, why did you choose advanced pain management?
I chose advanced pain management actually a long time ago. My primary care physician recommended him when I was having some lower back hip issues, and he actually worked at a different facility and moved to his new building, and I followed him. I love his service. I love the way he treats me as a person, and he makes me feel better.
That's great. Explain Dr. Yaknick's process when caring for you and how it helped you achieve your goals. And if you want to use Dr. Yaknick's name when you're referring to him too, that would be great.
Okay. Dr. Yagnet, when I first met him, he did a history on me, a medical history on me. What kind of problems have you had? What do you do for a living? And then he did a physical exam where he actually, made me bend over, do different kind of tests to see where my problem was at and what exactly was the stress point, so he could be assured that he was treating the right area. And then he came up with, well, we can do several different things, different ways, and he gave me options of treatment. And he explained what each one would involve and what the side effects, good parts, bad parts might be of each one, and let me choose. And, he supported my choice. And he did the treatment, felt better, and happy.
That's great. How would you say your life has changed since meeting with him?
After meeting with Dr. Yagnet, my life has been better. I sleep better because I can actually lay in positions, it's like 30 minutes, lay in one position, start cramping up, have to move, lay there 30 minutes, have to move, and just didn't get much sleep. And now I can sleep, I can lay in positions, I can sitting, on hard benches, like sitting at church is just really hard. My back spazzes up and it just hurts. And now I can sit there and I'm like comfortable. And so I feel better. I don't have to worry about, well, I'll sit in the back of the church. So, I can stand up. So, yay, I'm glad I met him. I'm glad he's treating me. I'm glad that he's doing the things that he's doing.
That's great. Would you recommend advanced pain management and Dr. Yaknick?
I would recommend Dr. Yagnet and to anybody that I meet, and I have. I've told my family and friends that have issues that I'm like, please, just go, go see him. You'll be happy. And
Stop for just 1 second.
Sure. Two others?
I would recommend advanced pain management to others, and I have friends who have back issues, neck issues, and I'm like, you've tried this, you've tried your way, try this, and now I'm like, he's such a nice person. He's not hard to get along with, and he doesn't medicate you. He doesn't make you feel awful during the day without pain. He actually relieves the pain.
The staff, okay. What would you say about the staff at Advanced Pain?
The staff at Advanced Pain Management, they're great. They're so nice. They know me when I come in. They know, and I think they would treat anybody like that. It's not that I've been there so many times. It's just that they're that caring and they want to remember. They want to take care of you, and you can feel that when you walk in. The nurses there are just super nice. I had a procedure done not too long ago. The nurse came and sat down with me and chit-chat, and I'm like, she doesn't have to do that. I know she must be busy, but wow, this is nice. And it's just nice to have that personal attention, as well as being taken care of and know you're being taken care of, because they're doing things behind the scenes that you don't know, but, you know, they make you feel just attended to.
That was great.
That was good. That was good.
That was really good.